Legal Service Developer Program is a statewide organization expanding the quality and quantity of civil legal service that's available to older adults and adults with disabilities in Montana. We work with everyone from larger communities like Billings to really tiny communities who are really, really far from, the nearest possible attorney. We work primarily with older adults and also with caregivers and family members, and we work around civil legal issues. We put on what we call legal document clinics, where volunteer legal professionals from all over the state come and provide estate planning documents to folks on a one-on-one basis.
They do want to get their estate documents in order. It's something that they've been procrastinating oftentimes, and this really puts it into focus for them. So they want to get their wills done, their powers of attorney, and some of the other legal documents.
The tool that Compassion and Choices has developed is a really wonderful component to say, here's one more step that we want you to take. Here is one more directive for your healthcare that is very specific to Alzheimer's or dementia that you can include as part of your overall estate planning process. And it gives them the opportunity to make some of those decisions that aren't part of just drafting a normal healthcare power of attorney.
Dementia Values Priorities Tool was used at a clinic where I recently volunteered, and it was very well received. It's an extension of them being prepared in the event that life takes them that way. The clinics that are provided, they're just priceless. We just see so much. The people are so very thankful that they've been able to come in and get those documents completed. A lot of people have said, I've been meaning to do this for years.
I had the opportunity to take advantage of a legal clinic, and that's where I saw the paperwork for the advance directives. I myself have not been diagnosed with dementia. Both my siblings have been diagnosed with Alzheimer's or dementia, and one is now currently in memory care. But watching my siblings go through this at the same time has made me more aware of this may be definitely a family issue, and then trying to plan ahead. It also made me very aware of how stressful and difficult it is for caregivers that are not prepared for that. And as a sibling, it's really hard. But when it's your family and when it's you, I think it's hard to put aside that emotion. So I thought, head start, do it early.
I have been in the role of caregiver for both my grandparents and then for my mother-in-law, who both passed. My grandfather passed from Alzheimer's when he was 94. And I'm not sure that the healthcare decisions that we made for him were what he would have chosen, and I wish that we had asked him before we were making those healthcare decisions.
As far as a caregiver, because of the emotional involvement, I think it would be difficult for them to make that call without a real sense of guilt. And I can look at this tool and say, I can make this decision that my daughter does not have to make the decision. Because we don't know what's going to happen. I mean, we don't know what's going to happen tomorrow. Knowing that it's taken care of, I feel settled, I guess is the best word I could use.
It's a conversation you need to have early. It's a conversation you need to have often. And it is as important for this person who is living with the disease as it is for caregivers. It's a whole community experience. And the more people that we can involve in this process, in these conversations, the better.